tugicokereria na no ndiragethagathaga tugikigutuke kuria bunge Karo akiharirika tukione uthuthuria na uhoro wa ciuria muthuri njui miaka mingi tugumutahi Kagwe kuria bunge riu ri he kaundu twakorwo twari na no kahinga tukwenda aria nao marumburana na ngigi macoke ku ngigi igereire maturi uguo oiga ati kwi bacteria itigagwo ningi ndiraigua muthomi muge mwega aria roya ona ici ikuite agacirora akarura out ka kwina bacteria kana kindu kingi ingikorwo ikuite mwanjira atirire haha ona corona ino turagweta muga viruses ni kindu iria ciuikaine ni 300
matwendi
ira documented so corona virus yo nyene
ina nyingi
fungus girigana ria 40
yes no menye fungus no survive ewoiki namba ona bacteria ni go survive ewoiki ndirakuni
bacteria mwanjira icio na itio
icio ne nyingi muno
ngugeragia kuyuria terere riu ta moshari tondu ikoragwo kuria turiri na ndwano mathambagio ri nyamu ici igacoka igatuika mai macio no matukana na siwaraini ri na ndaririkana kira swine flu yokire ni kuria China giko kiu gigithii gikingirana na mai ma kunywa andu makiambiriria kunywa mai uhoro wa nginya ona miakire nura turaikara ndagitari to no na riu turakaio ni coronavirus na ndirero ni mware wa nyina na SARS
icio ni itaranĩirie icio ni just
they are cousins
yes they are cousins
kai tweko
hari this microorganism nyamu ici ni no twi haraihu we have a long way to go tondu na ngwiciria this is the same thing iratumire China yuge andu acio macino tondu ni meciririe that concern we nayo tondu ni marumitwo ni no gwitwo swine flu H1N1 haria sewage yatukanire na mai ma kunywa so kiria twagĩrĩirwo ni gukorwo na ndagika ino ona in prevention okorwo ni system irathondekwo ni twagĩrĩirwo ni gukorwo tukimenya one mai maikare kado ndiwe to ndikire na experience iyo na ndire that department yakwa no I do believe mai ma sewage matinyitanaga na mai ma kunywa number 1 na number 2 system teo ni gwethie gukorwo ringi mochari ni satisfied no nginya korwo drainage yao ni maroretwo muno in how giko kiu kirathie and how ikiuma kira purify what ni go gitigathie the sewer system but reke ngwire okorwo he handu medicine itself itari ya hota gukinya na handu ituire ikachaga up ni microorganism ici tondu ngitwiria kindu ta virus ya HIV ya documentirwo case ya mbere 1980s rigo rarora miaka
no coronavirus ri don't at
1970s ona 70s na 1970s ni mari na ni mame isolate na makamenya ni weno but ni rathi na mbere na commutate every time mo katondu yok ni rathi kidriftaga so koguo umenye as I say HIV yagirirwo korwo ni kindu kiraithi na withirite these viruses these bacteria na these fungus ni mutataga very fast tondu hari kiria
ndiratho nyambe thii kuria bunge twaria na Karo Kinyugo Mwaura Karo Kinyugo tuone kuria muthuriti mutahi Kagwe agithurimwo ni abunge
where one goes to execute a responsibility that Kenyans intend that it be done. So I would like to assure the Honorable Bandi, through you, Mr. Chairman, that that is a task I take very seriously. And there would be no point of all these experiences I have gathered over the years if I am going to go there and not use it. Thirdly, Mr. Chairman, on the issue of the universal health care, indeed, I have looked at some countries. I've looked at some very successful countries. For instance, Thailand. And it is good to compare oranges with oranges, because I hear people talking about Canada. It is true that in Canada they have got total and complete, health care. But unless that oil in Turkana, becomes a serious issue and we are overwhelmed by resources, then we can be able to do a Canada style, healthcare system where it doesn't really matter You know, nobody cares about it. You just walk into a hospital and you're treated because there is enough money to do so, or if you're Saudi Arabia. But when we compare like nations, you know, the Thailands of this world and other Asian countries, and then the experiments that have been done, for instance, Thailand has been very successful. Some Danish countries have been very successful, even though some of them that started off by giving only tax-based healthcare are now rolling back and saying we also need an insurance aspect within our tax base, within our insurance base for universal healthcare. I think the principle is this, Mr. Chairman, as I see it, because it is one thing to say we are going to copy best practice elsewhere, but even best practice elsewhere must be brought into Kenya, and then it must be the basis on which we start our own system that is responsive to the environment in which we exist in our nation. And the point is, Mr. Chairman, that when I spoke about citizen responsibility, it must be part and parcel of our healthcare. It is irresponsible for us, Mr. Chairman, to say that one can walk into a pub, drink 10 beers, which cost 1,000 shillings per day, and you walk out of the pub and you fall on your face, having drunk 10 beers, and expect that my taxes and your taxes are responsible for treating the injury you got on your face. There is something wrong with that equation, and we must be honest, and we must face it, and we must say, if you can afford that level of intoxication, you can afford an NHIF card. And it should be mandatory that you must have one. And if you look at the countries that have moved to success in universal healthcare, they have moved a lot of voluntary contributions to mandatory contributions. And Mr. Chairman, I will be seeking the support of this House in legislation so that we are able to bring quite a bit of the people who can afford, so that the principle, to paraphrase John Locke, the principle of those able are taking care, those most able are taking care of the least able, applies within our insurance system. Because insurance operates on the premise that not everybody is going to be sick at the same time. But at the same time, we also expect that actuarially calculated, and given what we are putting into NHIF, we should be able, Mr. Chairman, to take care of a large number of people who are unable to have insurance. I think, Mr. Chairman, to me, the government should be able to hand over a card so that with that card, you can go to a hospital, so that even that card gives us an idea about what sicknesses people are having. Because without it, we don't have any data. We don't know what's happening right now in Gamwa, in a clinic in Gamwa. We don't know whether an outbreak is there because we do not have the data. So in response to your question, therefore, through the chairman, I want to say that we need some legislation mechanism that is going to reorganize the insurance and therefore NHIF in order for us to be able to be an effective nation. We are only at about 19% of insurance. Ghana tried it. Ghana went very high initially and then came down very fast because of the issue of the voluntary contributions as opposed to mandatory. Thailand was very successful because of the movement of voluntary to mandatory. And therefore, these experiences will teach us to do something.
Let me hear some voice from, I don't want to use from the man, Honorable Sankok.
Thank you very much, Chairman and Honorable Speaker. My question are two. One, there is a worldwide disaster in terms of coronavirus. How will you intend to tackle it? Because we face an imminent danger that an outbreak may happen. Secondly, health services in Kenya is not friendly and accessible to persons with disabilities. And I can give you an example. women with disability face massive prejudice, stigmatization, and discrimination in our health service. In fact, when a woman with disability is pregnant visit a health center, the first question will be, even if you get pregnant, surely, she's just a human being like any other person. The second question will be, how did it happen? We know how pregnancy happens in human beings. The third question that they will ask, this man surely must be a beast. And probably even that health personnel who is asking that question, she's pregnant herself. But she said, the one who impregnated as a woman with disability is a beast. So how will you really tackle these issues so that at least our health services is all inclusive, is accessible and friendly to persons with disability? Thank you, Chair.
Thank you very much. Let me start with the last one and then move on to the first one because of the importance of what you have said. Mr. Chairman, you know, it is unconstitutional. It is unconstitutional to discriminate against anybody on the basis of disability. In fact, the Constitution specifically spells out the word disability and says how it is an offense. Not only is it a moral offense, it is actually a criminal offense to me how somebody can treat any individual like that. Mr. Chairman, one of the challenges of medical care in this country is what one might call non-clinical, non-clinical issues. And Mr. Chairman, I think anybody who has been in hospital in this country can actually give an experience of how they were treated. The doctor might have seen them and treated them, but the non-clinical issues, which is what you are calling the non-friendliness, in a hospital, is one of the challenges that we face, because it is not enough that you are treated clinically. It is also important for you to feel like a human being, and for you to feel respected, and that is a very important part of treatment, because one can treat, give you service in a gyno service, but they leave you feeling very bad with yourself, where you are actually depressed because of the questions that were asked. And Mr. Chairman, I have had a discussion with some of the doctors and union members of Medicare service, and this is an issue. And the surprising thing that I learned from my colleagues in the ministry I was at before, and hopefully the ministry that I will go now, is that the training, and I know there are some doctors even within the committee.
Ni Muthuriti Mutahi Kagwe akiri minister hau kabere, ningi akiri senator kuria Nyeri, na akiri ningi mumbunge wa kuria mwena wa Mukurweini, na akiharirika no tugukimweta haha no akiona ni mathira no akiona ni githomo gia kuria Rware kuna mathaa maitu tari guthii marathi magithiraga. Na kiuria kingi nguongerera hau ni ati ona gutiri kuracokerwo mundu akarora ngigi ici tondu ni iroka ri ciakua niki ciana kio niki ciatigana thutha hari maundu maya hari the new world order maundu maya ukona riu US ni rekira kindu milioni 800 wete ndiramenya maruga mekurwa na ngigi naki kana horo wotuiria no kunengerwo ndagitari.
Ucio ni horo murito hari ndeto icio tondu I think ira donate this week, so ntugweterera, but I think hari urigitani na hari healthcare oguo minister Mutahi arauga ni undu umwe. One, the system no nginya korwo i ambitious, na kiria twagirwo ni gukorwo tukirora ni ati gutire copy and paste hari kurigiriria murimu, na kurigiriria murimu to guceka thakame ino ni part imwe ya ngigi kurigiriria mirimu ire ngi associate in future, number 1. Number 2, hari uria turathondeka ndoitu, na the other thing is cost ire associate na healthcare tondu ndutingigitura nyingi no kuhoya na gweterera kuheo tondu ni kuma murimu kota China ni maretereire kuheo. I think they will be in a far much worse gukira kahinda gaka. So the new world order ni system ituike self-sufficient. na system uria ndauga nĩ kuga system ĩkorwo ĩkĩhota kũ protect its people from a detriment of financial kana ugakorwo atĩ wĩna mũrimũ na ndũngĩhota gũkinya mwena ũrĩa ũngĩ harĩ thibitarĩ. Na the other thing is mwagĩa disaster mũgakoragwo na system atĩ nĩ mũrahota locally kũ produce indo na locally gũkorwo mũkĩhota kũdeal na calamity ĩyo ĩ hau. Tondũ the thing we always wonder nĩ atĩ mũndũ ũranone ndĩtũ ũmũthĩ gwakwa kũngĩhĩa kana ũmũthĩ gwakwa kũngĩka kaũndũ ngwĩte at your mercy nĩ rĩrĩa ũngĩenda kũhe kĩrĩa ũrahe. Na mĩrimũ ĩmwe no ndĩhetagĩrĩra your mercy, mũrimũ ti cira atĩ tweterere rũciũ oke rĩrĩa ikauma. So the new world order na harĩa tũngiuga nĩ system ĩhũrĩ ũguo waigua Thailand. Tondũ system ya Thailand ona nĩ confused western healthcare nĩ marigagwo ũrĩa megwĩka nayo. 20,000 ũraiga 20 years ago koguo andũ I think poverty ya population ĩyo yarĩ gĩcunjĩ kĩa 20 harĩ 100. Na kĩrĩa system ĩyo yekaga nĩ atĩ magũraga system makompitaga thirikari yabandaga system iria ciĩna goro, technology iria ĩna goro gũkĩra ĩrĩa ĩramateithia. 2002 nĩguo manjirie universal healthcare. It was so ambitious yathekagwo Turkey. Na what they did is nĩ kuga nĩ tũgũkava andũ othe na nĩ tax tũgũtax andũ. Tondũ the problem na universal healthcare nĩ inyuĩ mũbandaga indirectly or directly. Tondũ
arĩa marĩ na arĩa matarĩ
arĩa marĩ na arĩa matarĩ
na arĩa marĩ makahũrwo igoti
iyo nĩyo ĩbandaga. So nĩkĩo wonaga na Obamacare, nĩkĩo wonaga Medicare ĩkoragwo na political uphill gũkoragwo nĩ kũraingĩra siasa thĩinĩ nĩ ũndũ wa ũguo. So by 2011 I think 2014 marĩ 98% nĩ makavĩte. Ũmũthĩ ũyũ tũraria per individual in Thailand cost yao yũkaga $80 a year. Ĩrĩa thirikari ĩrĩa cost nĩ ũrĩa mahotire gũkoragwo control mĩrimũ, nĩ ũrĩa mahotire gũkorwo magĩ control educate andũ kũrigĩrĩria mĩrimũ. Andũ acio cost per person this today nĩ $80 per year.
Atĩrĩrĩ ndagĩtarĩ tondũ ũrĩ thĩinĩ wa public na no ũrakĩrutana ona andũ arĩa maragĩka ũrigiti harĩ mĩario ya minister Mũthuriti the nominee wa ũgima wa mwĩrĩ wona oiga atĩ nĩ mũndũ ũkũhota wĩra ũcio na korwo tondũ no tũrakĩrorerwo nĩ maũndũ marĩkũ agĩrĩire gũkorwo akĩmenya rĩu agĩũka thĩinĩ wa ministry ĩno ya ũgima wa mwĩrĩ.
Congratulate, and he has a very deep insight into what goes on there. Tondũ anathiĩ thibitarĩ nĩ arahota kuona cia rũraya, nĩ arona citũra ihana. And I can tell you what is happening now. Primary health care nĩyo priority ĩrĩa tũrekĩrĩra thĩinĩ wa universal health care. In the past ndũngĩakorire andũ ta ithuĩ magĩthiĩ beyond level 4 makoragwo me level 5 level 6 consultants. Today as we talk ngwĩraga maita maingĩ mũno ngoragwo nyumĩte gũthondeka andũ kũrĩa icagi-inĩ kũrĩa macinani tondũ nĩtwariaraicire if you reduce the gap between the most experienced person mũndũ ũra understand ũhoro wa health ũngĩreduce gap yake na kũ make sure nĩ arakinyĩra harĩa macinani nĩyo twĩtaga tiba macinani andũ nĩ mekũhota kũmenya mĩrimũ na ihenya tondũ ndũngĩtigĩra nurses wĩra ũcio wa kũ-diagnose. You need a consultant, and that's what we have been doing. We are going to communities, primary health care nĩgetha tweherie element ĩyo ya rĩrĩ misdiagnosis, tweherie cost ya mũrimũ gũcerithĩrio gũthondekwo.
Primary health care nĩ tondũ ngwĩciria
primary nĩyo field yako, and I'm very passionate about that tondũ hau nĩ harĩa mũrimũ ũcio ũrageria gwĩtunga rĩ, hau virus ĩyo ĩrageria gũkũrĩra kana harĩa tũgathiĩ ho. We don't wait for diseases to come. Tondũ infrastructure rĩ, mũrimũ, the most important part ya health nĩyo ya resource personnel qualified na kuma facilitate gwĩka kĩndũ gĩtagwo community diagnosis, ĩtagwo community strategy. Rĩu tũkoretwo tũkĩallocate akorwo doctors in the sub counties magakorwo in charge of a specific area with the dispensaries na andũ metagwo community health volunteers. Even the major stakeholders in the community, we incorporate them, church elders and all that. Nigetha magatuĩra tondũ mĩrimũ nĩ ĩrehitha mũno magatuĩra haha he ũndũ tũrona, and then we move there. Na every day we analyze data from those communities tukona nĩ thĩna ũrĩkũ twakora. Ta rĩu last Saturday twatindĩte kũrĩa Kĩgumo mwena ũrĩa wa Gatũmbĩ na tũgĩkena we treated over 400 people free tondũ kĩrĩa tũreka nĩ kũ preempt mundu taru twathi kwa tugakora andu mena very high blood pressure no wa muthondeka ndekugia na stroke ino ingituika ni guthondekerwo kuria level 6 hospitals iratu cost millions but when you go to the village and you prevent those people from getting a stroke you save the millions. That's what we are doing.
Tuko tukiuga horo hari kiugo kiu tandu ni njui ehita o ni muthuri mwega ni muthuri tungita uciri guo niguo tukwirira andu arikia kunywa muma no tutigake mwito ha tucokanie ndundu twina minister na inywe ha muri kwa tucoke tuongerere ndagitari kamuri wa kuria Kenyatta National Hospital bwana CEO na marata witu tukorwo tugietha kihonia no tukiuga horo igi universal healthcare twakiona riu mundu urahota ku understand kuringana na uguo araria ana kwari minister na maundu matiganite twike ati ata bururi gutigirira ati ona virus ingiuka hena igunyo ingi ciukite kwanyu cihandagirira andu o mirimu o yothe ingiuka ati ni rahota kunyitirwo haria family-ini.
I think withamba ni kuruta nguo na whether you like it or not he two ways ungihuthirira hari urigitani. One, no uthie the hard way uikare thi weterere murimu woka ukadiru naguo neyo ikoragwo very expensive tondu niyo curative. The other way preventative niyo the best way guthie
na niyo
preventative na niyo ndagitari agwetha haria one muthie mucarie mirimu ino iku don't wait. Na I think universal healthcare no ngerora iria system ya Najia 1800 kuria niho Germany yajagia ni majirie na primary care mukorwo tiga guthi special primary care muge mundu wothe a screenwo sukari mundu wothe a screenwo pressure mundu wothe a screenwo cholesterol mundu wothe na murihe twike compulsory o uguo no okorwo ni wonekana na sukari no me control premium yaku igatwika easier. Aiko ni uranywa thigara na ni werwo unyutige na nduratiga uka pay for that tondu ni tuwe kunywa thigara gukaga control sukari gukaga control pressure ni gukuhe stroke. So I need uringiwa ogwo iga ni ati system ndungi copy no paste aigira ni ekuhota kumenya uria guthie na system ino no copy no borrow. I think the best way ni kuga no borrow ideas iria iwakite kundu kuria kungirokana ni kuruta wira. No, the best thing the primary care na preventing the diseases tondu iyo niyo igukorwo i cheaper. Sukari kuhe dawa ya sukari no mitwe ciringi 2 kana 3 muthenya no guthenga kuguru na gwika dialysis ni 10,000 na kuthie na iguru.
Andu makuoneko
ni ngoragwo St Peter and Ann Medical Center ni ho thibitari itu iri tukoragwo wahe tukarwa kaitagwo Kahigo Stage na turi Facebook St Peter and Ann Medical Center Rwaka na namba itu ikoragwo 0722016801.
Ndagitari tukiuga horo andu magikuoneko
moke o thibitari wa thirikari kuria Ruro Maragwa na nitura request andu ma register ciana iria ina mathina ma orthopedic mahindi tondu twina ndagitari mekurehwo ni thirikari itu kuma Spain
magokari
mweri wa 3 tukorwo na ku mweri mugimi nigetha turore mirimu iyo ya ciana icio turerwo cingikorwo na special need no ni wega moke ma register ciana icio cionwo ni orthopedic pediatrics surgeons ni meguka kuma Hispania na no magacoka magiuke uria moka guthondeka mirimu iyo ingi. Iyo ni program ya thirikari na ni njega tondu niyo twiga primary care andu mathondekerwo kuria mashinani matige gutinda magishift kuma kuria muci.
Asante sana.
Asante sana.
Chutu manake ni Daktari Stephen Ngige niwe superintendent kuria Maragwa Sub County Hospital kura muga no wira na ningitumwa na ndagitari kinothia njega kuma kuria Kahigo Stage St Peters and Ann. Wairi tukorwo twina Michael Njenga hamwe na Professor Ngugi Njoroge thiini wa radio itu ya Inoro kuma thaa 4 nginya thaa 6 cia utuku. Tukwambiriirie na ithagumia na no tukorwo tugitiria nario thaburi 90 thaburi 90 14 na 15 thaburi 90 14 na 15 iroiga tuhunagie utugi waku rucine o rucine niguo tukenage na tucanjamukage matuko maitu mothe tukenia matuko o ta maria utunyaririte na miaka o ta iria tuonete mathina mugie na muthenya mwega na horo uria twerwo muno ni horo wigie preventative and curative medicine mugera muthenya mwega tugudai kwira hwaini tukorwo twi thiini wa tabarira itu ya ukera thiini wa radio ya Inoro. Muthenya wa rucio haha mwakorwo mwina Maiko Njenga kuma thaa 3 nginya thaa 5 na maundu mega maria akuhaririirie. Koguo nie tucoka twaicemanie hwainĩ thĩinĩ wa Radio Inoro. Daktari, thank you muno.
Na karibu sana.
Thank you.
Ndeka ũndũ ũmwe.
Ndio muramukorwo muri ambassador itu.
Thank you.
Yes,
Mwathi
thank
mũgĩthondekia andũ.
you. Thank you.
Asante sana. Muge na muthenya mwega.